Hello, welcome to my video presentation of cerebral palsy, and I am Nicholas Padamas. What is cerebral palsy? Cerebral palsy is a group of disorders that affect muscle tone and muscle movement. Cerebral means brain, and palsy means weakness or problems with body movement. What causes cerebral palsy? Doctors are not exactly sure what causes the disease, but what may cause it, they found out, could be lack of oxygen during labor and delivery, gene mutation that can cause abnormal brain development and head injuries, like falling when you're a child, being dropped. So a lot of these causes are from being a child. Medications and caring. Many people who suffer from CP get Botox injections because it relaxes the muscles, just like how people get Botox injections in their face to not develop wrinkles. They get in their muscles to loosen them up. They are often prescribed muscle relaxants as well to relax the stiff muscles. Diet is very important with patients who have CP because their bones are weak, so they would need a high diet in calcium for those weak bones. So diet is very key and very important. Alternative therapies. This is actually very interesting when I was doing research. One of the alternative therapies is hippotherapy. Note it does not involve hippos, but it is horseback riding. So while riding the horse, the rider must mimic the horse's trot in order to stay upright. This allows for the rider's muscles, bones, and joints to properly align. So involving the core helps the patient develop muscles, bones, and joints properly and to align them. And some of the other improvements for hippotherapy can be abnormal muscle tone, impaired coordination, decreased mobility, poor posture, impaired balance, and impaired limbic system function, which is emotion, behavior, motivation, long-term memory. Another therapy is music therapy, which improves cognitive functioning, speech, and motor skills. And some of the other things that can improve with music therapy are language processing. When you learn the song and you sing it, it allows the brain to develop the language. Auditory responses, so listening to it and saying it back. It helps relax them, just like how everybody uses some music to relax them, and it relaxes them, so it promotes relaxation. And it helps their range of motion, just like learning a new instrument. With the drums, they have to move around, so it helps with the range of motion. And acupuncture is another alternative therapy. It can improve neurological functioning and muscle hypertonicity, which is an increased tension of the muscles. And it can also improve weakness of legs, arms, and hands, loss of speech, loss of voluntary movement, loss of hearing, and it can improve the pain management caused by the central nervous system. This is actually an interesting study, or a case study, if I may say so, about acupuncture, and it involves a 6-year-old named Michael who did a total of 15 sessions of acupuncture, and before acupuncture he was not able to speak in full sentences. He had very poor coordination with his upper body and lower body, and so after the 15 sessions he was able to speak in full sentences. He had improved coordination of his upper and lower limbs, and besides that, his math and reading scores improved by a whole grade level. So I thought that was very interesting. How to diagnose CP. Some doctors are able to determine CP right after birth, but majority are diagnosed after 2 years. There are no definitive tests to determine if a child has CP, which means they can't just take your blood and say, oh wow, you have CP. No, but the doctors use a combination of assessments to determine if the child has it. So some of the assessments are performing physical examination of the baby, reviewing pregnancy, labor, and delivery records, reviewing baby birth, medical development, and growth records, and conducting lab tests. So they would do the blood work and urine analysis, but they can't determine that from the blood work. Doctors are hesitant to fully diagnose a child until the ages of 3 to 5 due to brain developing more. How exercise improves CP. Exercise, which is pretty much physical therapy in a whole, are geared towards helping patients with either high or low muscle tones. High muscle tone causes stiffness and spasticity, and low muscle tone cause too much flexibility and weakness. So there's a couple different types of CP. Exercise helps improve those conditions by improving coordination, balance, strength, flexibility, endurance, pain management, posture, gait, and overall health. So exercise is very important. But with how important exercise is, sometimes patients with CP have difficulty exercising because cerebral palsy causes muscles to either stiffen or become too loose. These symptoms can make exercising a lot harder. And while working with the patient during the program at Ram Tough in Westchester, it was very hard for me to move the patient out of her wheelchair. Her legs would stiffen up so much that I would actually have to massage the back of her legs to be able to move them just a little bit, to be able to stretch them out. And gaining muscle strength will help the looser end of the CP with the looser muscles. Here's a little case study. Kate, who is a 30-year-old female, who has spastic cerebral palsy, which is stiff muscles. She says she enjoys working out and does at-home workouts when her parents remember to remind her. Her BMI is 27 and is not on a diet plan. Her parents say that food makes her happy and they only want to see her happy. She uses a wheelchair to move, but can walk. Her goal is to gain flexibility, strength, and to use her wheelchair less. So what we learned from that conversation with Kate and her parents is Kate is overweight according to her BMI, but enjoys working out, so she is motivated to work out. Kate is not on any diet plan, but should probably be on one to lessen the stress. Her parents are very passive with her, which isn't necessarily a bad thing. They want the best for her. They want to make her happy, but they need to be a little more stricter on her and her diet, and to remind her to do her at-home workouts. Kate wants to be able to move around more freely and gain some independence. She can walk, but it's very hard for her, so she uses a wheelchair. She wants to be able to walk easier so she can gain more freedom. So the exercise testing we would do would be cardiovascular testing. It would be a 6-minute walk, but with her we did a 1-minute walk test to ease her into the walking because of her disability. Kate was able to walk 20 feet in 1 minute. Flexibility testing. We did a chair sit and reach test where she was able to bend slightly past her torso. So we wanted to see how far she could bend. And strength test, we used the hand grip dynamometer where she was able to produce 2 pounds of force. So we were able to see how strong her hands were at the time. So the exercise prescription that I would show her would be cardiovascular training, which I would want her to do 3 times a week. Mild to moderate intensity interval training. So start out with 20 to 30 VO2 max, and with 2-minute intervals of level up training. So every 2 minutes we do a little bit more resistance. So we want to end up with 40 to 50% VO2 max for 30 minutes, and I wanted her to use the exercise bike. So flexibility training is very important with patients with CP. So I want her to do this every day, which is mild intensity basic stretching for large muscle groups for 10 minutes, basic stretches with help from parents because she can't do all the stretches by herself, and resistance training. I want her to do 3 times a week, mild intensity, working on basic core strength, upper body and lower body strength for 30 minutes. And I want her to use resistance bands, which she can get and she could do at home, and body weight training, which is very important because she needs to move her body weight to walk more. So the precautions and modifications that I would say would be Kate needs to be under supervision throughout the exercises. She has a disability which makes it harder for her to move, so it causes more opportunity for her to hurt herself. So she needs to be supervised. Kate will need to start with a warm-up before each exercise, just like everybody, and a cool down after the exercises, just like everybody. So some of the warm-ups she could do and cool downs would be walking before starting the bike, and after the bike she can ease down the resistance to cool down. Light body weight training before the resistance training, so before the bands, just to get her body moving and aid in the recovery process, and stretching after each workout to aid in the recovery. So, and to help the flexibility. Since she will not be able to do a lot of the stretches by herself, she will need assistance from her parents, just like I said. But some of the stretches, like knee to chest, she will need her parents to push her knees in to develop the flexibility more. And my conclusion for CP is a neuromuscular disease that makes it difficult for the patients to move and communicate. With exercise, a patient with CP will be able to improve overall flexibility and strength in order to move more freely. So exercise is very important. There are different types of CP, but almost all cases can be improved with proper exercise and caring. And